All right, guys, welcome to the podcast. Today, we're going to have a guest on that I work with every day, and he's Dr. Nick Masia. He's a chiropractor at our office. He did a podcast earlier that went really well, and today we decided there's a lot of repeat questions in our office, and I think when a patient's asking a question, the public's probably asking those same questions, and we decided to get a bunch of questions that were we thought were pretty good questions that patients ask us all the time, and just run through them. For anyone that doesn't know, Dr. Nick Masia, he's a chiropractor, a CrossFit athlete, dedicated to his craft. He practices what he preaches. Like I'd say, I like to have people on the podcast that are pretty all out, right? They practice what they preach. No hypocrisy. Probably won't have any politicians on the show because of that. But we're going to have a lot of guests coming up that are pretty exciting, and it's always a good time talking to Dr. Nick because he's got a lot to say, and he practices what he preaches. So welcome to the show, Doc.
Hey, thanks for having me back.
Absolutely. You did a good job, so you get another shot. That's how we do it.
On for round two.
Round two, yeah, one of many, most likely. So Dr. Nick and I put our heads together. We talked to some patients. We opened up sort of a channel online to send in some questions. And these are ones we get a fair amount that I think are good. And the first one is, do we treat arthritis? And the first thing I'm going to say about arthritis, I looked up some stats because I just know that they say what a big crippler it is. And when you see somebody in one of those easy-go carts at the supermarket, and when you see a lot of people using walkers, of course, there's a million conditions they could have, neurological conditions, metabolic conditions. But most commonly, what they have is a breakdown of their joints to the point where there's then nerve pressure and problems. And that breakdown is a form of arthritis. There's hundreds of different types of arthritis, but certainly the most popular and the one that all mammals get, except for bats, is osteoarthritis. The general breakdown, it's still a little bit of a mystery as to why all mammals get this. Maybe the bats are hanging upside down and that has something to do with it, or maybe they're still eating their proper diet, right? They're eating bat chow, whatever that might be, mosquitoes, whatever they eat. But it's a $14 billion per year cost in our country to deal with arthritis. And that is the surgeries, knee replacements, hip replacements, and all the chiropractic physical therapy, injections, all that kind of stuff. So what do you think, Doc? Do we treat arthritis?
Oh, absolutely. Like you said, the most common one, osteoarthritis, or what everyone calls it, degenerative disc disease. They think they have this terrible disease. The doctor told them they have this terrible disease, and arthritis is probably one of the most common things that we're treating in people, just keeping their joints moving, especially in the spine. It's his most common. Arthritis is like wrinkles on your skin. Everybody's going to get it.
Yep.
It's just something that we're going to deal with. But with chiropractic, like moving the joints more, making sure that our mobility is improving and not decreasing over time is one of the things that we're treating every day. Absolutely.
Yeah, and like you said, wrinkles on skin is a great analogy because when people smoke, they get more wrinkles on their skin than they would have genetically. And when people smoke, they get more arthritis. I saw work comp studies that the injuries to employees was significantly more for the employees that smoked, and they were joint injuries, so chiropractic treatment type of injuries, neck, back problems, and that smoke was breaking them down and breaking down the cartilage in their body and the elastin and the ability of your body globally, from whether it's in your skin or in your joints. That's very similar material that just basically starts to break down. So we end up with that loss of range of motion, the discomfort, in the inflammatory reaction that a lot of us talk about. So the answer to that one is absolutely yes. It's after age 50, it's such a common finding. On a simple X-ray, you can see arthritis. MRIs, as Doc, show that as well, and the degenerative disc disease, and then the potential for herniation goes up and that kind of thing as well. So I give that a big yes.
Yeah.
All right, let's go ahead.
And then the more like abnormal wear and tear that we get. If people are more sedentary, then that obviously increases. So they're with more movement, and exercising.
Yeah.
And
Yeah,
like,
that's a good point. Either side of the coin, right? Too much movement. Someone's playing professional football and doing crazy lifts, and then not enough movement. People sitting, not getting those joints to stimulate properly. It's a lack of circulation. Either one, the joints break down from lack of use or overuse, like a lot of things in the body. Yeah. Another question: do we treat babies, and why do we treat babies? Well, I'm going to start that one off by saying we absolutely treat babies. I have 3 daughters, as a lot of people know, and I adjusted them hours after they were born. And the reason for that was the distortions that can occur during the birthing process. I looked up the amount of pressure put on a baby's head and neck, and it's anywhere from 60 to 120 pounds. Now, that is designed to handle that. The shape of a baby's head and neck, the shoulders come into the neck and kind of brace it a little bit. But that's a normal birth. Then you deal with complications in birth, and you deal with vacuum extraction, and you have a more significant situation. I've seen, video of C-sections where the baby is pulled through the smallest incision possible. And once again, the neck was kind of whipped around and the head was somewhat used as a handle to pull the baby out, which is, so all part of it. I was there at each of the births of my children, and it was, outside of being an absolute miracle, it is something that is looks pretty traumatic to a baby. It's if anyone hasn't seen a birth, it's really something to witness. So we treat babies, right?
Yeah, absolutely, we do. I don't have any kids yet, so I haven't treated any infants hours after birth, but someday. But yeah, biggest question that we get, because we have the kids room in room 4, and everybody's, you guys treat kids? Yeah, absolutely. So the techniques are obviously different. I think that there's a big misconception when people think you're treating babies, that we're popping and cracking them and adjusting them like we would a 20-year-old. So explaining the different types of care for that is definitely huge. But a lot of patients have great luck with their babies with chiropractic treatment, from colic to sleeping better, to all sorts of stuff. And if you think about it, a baby is inside their mother for 9 months. So they're not only is the birthing experience pretty traumatic for them, but they're crammed up in there for so long. So they're not moving around. Things do that's how we can get some kind of callus, anything like that. And babies sleep kind of funny too. So, we preach posture all day long. Babies don't always sleep the greatest, and they've been crammed up in their mothers for 9 months. So that's a great reason for them to get work done and make sure everything's moving correctly.
Absolutely. Babies also get injured. They roll off of things. Parents, unfortunately, sometimes drop them, and it's terrible, but these kind of things happen. And babies are designed to withstand a fair amount because they're cartilaginous, right? A lot of people don't realize a skeleton in a human being doesn't reach full maturity till in and around the age of 25 years, which means that you still are part cartilage, part bone up until that age. But when you start out, you're mainly cartilage. The bone is slowly mineralized as a child grows. And so that's why the techniques in chiropractic are so gentle relative to somebody who's fully what we call ossified, or fully turned, their skeleton's fully turned to bone. And we use a tool called an activator oftentimes, or times just very light pressure. And I always tell people it's more like molding something into shape than snapping something into shape. The joints are, designed at that point to be very flexible, and you're changing the shape and movement of a child's spine with such gentle care that a lot of patients will look and say, "Oh, that was it." I'm like, "Yeah, that was it." Right? It's such a subtle thing, because if you're changing the shape of clay, you don't thrust on the clay. You just gently press the clay, and it changes shape. And that's kind of the way I look at it.
Yeah, absolutely. Yeah, same here. I mean, like you said, babies get injured too. So my mom tells me about when I was a kid. I used to climb out of the crib at night.
That's not surprising. That's not surprising.
So they would be sitting downstairs, and all of a sudden they would just hear this thud, and it was me climbing out of the crib. They finally like watched me one night, watched me do it, and I'd climb out the side and hold on as long as I could, and not long, but and then all of a sudden smash down, smashing my butt on the floor. So yeah, babies get into trouble. They get injured just like us.
It's funny to hear that you were doing hangs and muscle ups, when you were, months old. It's not surprising. It's just funny. Well, that leads us to our next question, and you can start this one off. How do you treat athletes differently than the regular folks coming in?
Mm-hmm. Yeah. So the biggest thing that I look at when it comes to athletes is what type of athlete are they? What are they doing in their sport? What types of stresses are they dealing with their sport? Are they a weightlifter? Are they a basketball player? Are they what are they doing more? And when we know what sport they're doing and what movements they're doing more repeatedly, we know what imbalances to look for. So golf, right? So it's spring, golf is coming. So we talk about like a golf player in golf or hockey too, because when you look at a golfer or a hockey, they're doing one thing one way, very repetitive. Whether it's swinging a stick or a club, they're putting a tremendous amount of rotation through their body one way. When we work with a golfer or a hockey player, for example, we're looking to improve rotation both ways in their spine. So that's one example of it. But with knowing what they do, making sure that they can move through the movements that they're going to be performing, whether that's somebody in a gym, whether maybe it's a CrossFit athlete. I treat a lot of CrossFit athletes, as do you. So we need to know what they're doing in order to compete or train in their sport. And I put them all through a movement assessment. I want to make sure that their hips can move correctly, their rotation in their spine, they can bend, they can flex and extend and rotate equally all different ways for the range of motion. And they require a little bit more pounding sometimes than your average person. So looking at some of the different techniques that we can do on them, soft tissue wise, whether that's an instrument assisted soft tissue, almost like a Graston. We have a tool for that in the office that I use quite a bit. The Theragun, the athletes really like the Theragun for the Hypervolt rather for a lot of muscle work, things like that. So I would say the biggest thing that I would say that's different from an athlete treatment than maybe your traditional chiropractic patient is a little bit more more attention to some of the soft tissue aspects of it.
Sure.
Because definitely things get limited when you're in a sport. Like I said, you get imbalances, and let's look at soccer too. A lot of soccer players, I got this right hip pain and my right hip is always hurting. Okay, what leg do you kick a soccer ball with? It's a lot of the same movements over and over with that one part, with that one body part. So we need to make sure that one body part is moving correctly and it's able to keep, and the other side is able to keep up with that side for everything that they're doing. So balance from both sides, whether that's a strength balance and or a movement balance is something that I pay attention to. Like that's number one. Does everything move the same on both sides? And what's restricting it? Is it a joint that's getting restricted, or is it a muscle that's getting restricted, or a ligament? And in that case, we want a full range of motion everywhere we're looking.
Right. I think that's crucial. I mean, I pitched baseball and played third base, and I was always a thrower, right? So much of my body was strong on one side. I'm extremely right-handed. And when I first went to a chiropractor, got great results from migraines and did a lot of treatment, then went off to chiropractic college for a really deep, examination of every aspect of my frame. And I remember standing up on what's called the SAM machine, a spinal analysis machine, with plumb lines. And the guy just almost broke out laughing. And he said, "You're right-handed?" And he laughed. I said, "Yeah." And he's like, "Did you play baseball or something?" I'm like, "Yeah." So they took and stretched out my pec and my lat, and it was, bringing back some symmetry to my body, because I performed really well with that asymmetrical body in that sport. But then what happens when I try to do something else or just live a while, that starts to add up. So I agree, the symmetry thing I can speak personally about. And that's what I always do when I have athletes in the office as well. And some of the things that you and I've discussed about, the amount of soft tissue necessary, because they're taxing that muscle to its extreme. And you want to be able to recover that back. I know how much you're into recovery as part of treatment as well. I know you recommend all kinds of concepts, including those, talk a little bit about those pants you had me try on the one time at lunch, expanding pants or compression pants.
Yeah. So those are a great tool. There's so many different like awesome recovery tools out there, and the Normatec is one of them. The Normatec, if you could imagine, it's meant to move blood and lymph through and flush your legs. So they make these pants that are essentially look like big giant blood pressure cuffs, and they have different compartments, and the way that they hook up to a compressor, and the way that they're made is they start squeezing at your feet and your ankles, then they start squeezing up at your calf, up higher in your calf, and then on your quads, and then they release, and then they run through that system. As long as you want to sit in it, it'll inflate and deflate. And what that does is it's pushing blood. It's taking blood from the bottoms of your legs and pushing it up towards your heart to help your legs recover. Let's say that you're a runner or anything like that. We want to recover for our next training session or our next competition or run or anything that we're doing like that. So recovery is huge, and that's one of the things that when once we get an athlete, let's say that an athlete is coming in for an issue. Okay. That's usually what brings athletes in. There's a problem, and we need to fix that problem. Once we fix that problem, my go-to for them is, all right, let's put this in your recovery toolbox. Let's make this a thing that we're doing every couple of weeks, so that you're not coming in here just to get fixed every couple of weeks or months. We want to make sure that we're preventing further injuries so that you can continue to train, because once a muscle or a joint isn't moving correctly, the load that joint is supposed to take goes somewhere else. So I just had a patient this week, and she came in with a neck issue. She had a pinched nerve in her neck. That's what she said. So she had pain going on her arm, but we got that feeling better. And then she's like, oh, by the way, my elbow has been hurting me for a while. Well, come to find out, this person's elbow has been bugging her for a while. So therefore, the normal movement and mechanics that elbow was supposed to take was affected. So then she starts compensating somewhere further up in pain in the shoulder. Okay, and then there we get a shoulder or neck issue. So that's one reason why we need to make sure that we make this a thing, because one sore joint or elbow or ankle or knee or whatever it is can run up and cause something else. So preventative for being able to prevent further injuries so that people can train more. Kind of like the rock tape analogy. It's like go stronger, go longer, things like that. So and that's tape too at the office for recovery for some of the athletes. It's not my favorite thing to use always, because people think that, and they see it in the office too, rock tape's great for muscle activation, getting things to work correctly. People oftentimes see rock tape and they say, oh, just tape this up and it'll feel better. And that's not the case. We need to make sure that we actually heal what's going on, so that we're not causing further injury by letting someone think that they're feeling better because I have this rock tape and now I'm going to go, smash my shoulders into oblivion and carry on as usual. So that's one of the things that we can use also, but I try not to use rock tape too much.
Yeah, I think that, like you were saying a second ago, that you're looking at a distance oftentimes to find out where the problem actually may be coming from. That's an example. She had a sore elbow, using that extremity differently, bracing and compensating with the shoulder, and then ending up with a nerve pressure syndrome in her neck and down her arm. I always say that the problem is oftentimes 3 joints or 3 compensations away. And so often when people get lower back pain or headaches or neck pain, I'm looking at the arches of the feet. I'm looking at, when's the last time they bought a new pair of sneakers or shoes of some type. When I have someone down the table, they check their leg lengths. I sometimes comment about, how much time do you spend in these shoes? And some people say, I just drive here with these. These are my old shoes. Okay, good. Other people say, no, these are my workout shoes. And if they're, 4 years old and they start looking yellow and, they're cracking, they're not absorbing shock anymore. All right.
No tread left. That's
exactly right.
I hope you're not going too far in these. They got no tread on them.
Right. So you're going to deal with just, we walk on artificial ground all the time, and we need something to make up for that. And that's really what I think a good shoe does. It brings back the dirt, mud, pine needle, type of feeling, in a sense, that cushy to a degree. We can get into barefoot running some point, because that's an interesting idea as well, but to some degree. But yeah, I think that answers that question really well. I mean, we have different treatments for different people. Recovery is a major part of working with an athlete. And sometimes athletes don't come in realizing that we have that much information about that, especially in your situation. I think with the number of athletes you treat, a lot of them you work with personally as well, so they know that. But other ones will be like, oh, I thought you were just going to snap crackle me,
Yeah,
and that's one of the biggest, I think one of the biggest misconceptions of chiropractic is that we have this sort of limited idea because some chiropractors do. I mean, some chiropractors really keep it in a very narrow thing, what they do, which is fine. I'm not judging that at all. If they're really going to be good at one particular thing, go ahead and do it. I like to broaden my scope a little and be good at a bunch of stuff. And I just think it makes the day more interesting. And a lot of times people would never get that information anywhere else. If I'm going to talk to somebody about digestion and how that's going to affect joints, they might not hear that anywhere else. So, I think that's a very important aspect of it. Like we had Trish Williamson on last week in the podcast, and she got into a lot of great nutritional conversations with us. And it's so important with the whole foods, because you want to be able to nutrify that body so it heals, getting back to recovering itself.
That's one of the biggest things. I mean, obviously nutrition is a huge player in recovery from anything. So in the hierarchy that I use for patients is sleep is most important, always, forever, always. Nutrition's right under that, and then comes everything else. So if those two things are good, then we can start. If you're getting 8 hours of sleep a night and you're filling all your nutritional requirements that you're able to do, everything else comes after that. So when someone gets injured, and this is a great way that I feel like that we can put in perspective for athletes also, or anybody, is, people get injured and they'll stop working out, or they'll stop eating. Their diet goes out the window. Oh, I'm not training, I'm not working out, I'm not able to run, so I'm just not going to eat. Like, I don't want to gain weight while I'm injured. Well, not always the case. You need to think about injury is recovering from something, because oftentimes we need to fill those nutritional gaps. If you're injured, you have a ligament injury, a disc injury, a strained muscle, a torn muscle, and in our worst case scenario, we need to make sure that we're not starving ourselves so that we're able to recover from that. If we're under recovered, we're just one more injury, one step away from having another injury. And we're slowing down the one that we're trying to heal. So that's huge.
No, that makes a great point. All right. So next question, one of the things I get asked a lot, because it's kind of fun, is what is that popping sound with the adjustment? And there have been people that have actually believed that something was actually cracking. And, obviously that would be injurious, painful, and a hideous situation. So let's just say right now that I hope no one really believes that, or people may be joking about that, hopefully. But the sound is oxygen, nitrogen, and carbon dioxide in the joint being pulled sort of from the gas state and pushed back into the fluid state. So it's basically gas going back into a state, it's kind of a foamy state for a short time, and then it turns back into liquid. All the synovial joints in our body, which are most of the joints in our body, have a lubricating fluid made by the outer membrane. As that membrane produces it, it then is used as the lubricant, and then it ages. And as it ages, some of it becomes gaseous. And then when we adjust, we get that gas to metabolize back to that foam and fluid mix, and that speeds up the activity in the joint. So it draws and stimulates the membrane to make new synovial fluid. And the more you move a joint, the better that fluid becomes. You get a better viscosity, so it becomes more slippery. And that's what you want. You don't want water in a joint, you want butter. Think of it that way. You want a good oil, and that is made by motion, by simply using your joints. A marathon runner has a different viscosity synovial fluid in their joints than someone who's a walker or someone who's bedridden. And part of getting in shape is making better or more viscous or more slippery lubricating fluid. And the adjustment actually stimulates that a little bit. But for all the people that come in our office and all the patients out there of other chiropractors who go to techniques where we don't make sounds, why is that fine? Well, that technique just doesn't necessitate that level of pressure or torque. A lot of the more tractioning techniques, one we use is called flexion distraction. It does not necessitate a popping sound. And the popping sound, it also is not what makes a person better. It might feel better in the interim because we're taking and changing the pressure inside the joint. But I always make sure that people realize the sound is an indication that I moved you most likely further than you normally move, right? Because if you normally moved, the gas would have popped out, right? So I'm moving you slightly further, and I do use it as an indicator. A lot of times the more sounds, the further it traveled and the more relief a person gets. But in the long term, our job is to enhance motion and reposition joints so the nervous system can conduct from brain to body and body to brain without interference. And bones can interfere, fluid can interfere, disc herniations, there's a lot of things that get in the way of that nerve transmission. But that's how I say it. I mean, what are your thoughts?
Yeah, absolutely. I mean, that's usually the number one question, like, what's that popping sound? And someone who's new to chiropractic, like, well, that's the first thing I want to actually tell them is, listen, when you hear this popping sound, it's no different than the popping that goes on in your knuckles. So if your knuckles, and most people have, it is the same exact popping sound that's coming from your knuckles. We're not taking a joint. I get the line that the joints on the desk, the spine, the spine models. And so we're not taking one bone from here and putting it over here. We're not breaking it in half. We're restoring movement. When we do that, there's a gas that gets released from the joint capsule, and that's what makes that sound. So it's from the high to low pressure, almost like opening up a can of soda or soda pop.
Right.
Like that. Most people will get that analogy, I think. But I think they definitely hit the nail on the head with that.
Okay, cool. Next question. How long should you go to the chiropractor? Right. I think that's a great question because that varies tremendously. I have people that depend, and I always tell people, what do you want to accomplish by coming here? If someone asks me that on the first visit, like, how long are we doing this for? How long is this going to take? That's a very fair question. And we try to estimate the length of treatment by the severity of the condition and the length of time it's been there. If someone has 45 years of back dysfunction, to think that I'm going to do 1 or 2 or even 8 adjustments and they're going to be brand new again is absolutely impossible. Can I get them out of pain? Well, when you're out of pain, that's one thing. When your back is functioning properly, that's an entire different thing. We break care into 3 phases. Acute care, meaning someone's suffering and we're working on them almost every single day to get them functioning again. And then rehabilitative care, meaning we got you a lot better, but you're not as good as you could be. So we continue. That frequency usually drops down per week. And then maintenance care. And the maintenance care is the one that probably has the most questions about it because the person's feeling good. So why would they come in? And then you come up with the simple analogies of, do you only go to the dentist when your teeth hurt? Or do you go there to get flossed and scraped and plaque scraped and given advice and to be checked to see, is there anything from oropharyngeal cancer to forming cavities to gum disease to all kinds of crazy stuff that can go on inside someone's mouth. We're similar to that. We look at your back for things that might be going. A lot of times I find problems on people's skin when we're examining people. Other times, things in their abdomen. And then people come in and ask all kinds of questions. So for me, the length of time that someone comes to the chiropractor is a conversation, and it's up to both of us. If someone says, I'm only coming once, I'll say, well, then don't come at all, because chances are you're going to say you went to me and it didn't work. Well, you didn't give me a chance, right? One adjustment on a 45-year-old, 300-pound arthritic diabetic is not going to change that person's world. And let's just save this man the money and send him home right now, or send him to some other place where maybe he can get the type of treatment he needs. Send him to Trish Williamson. Send him to a physical therapist, or have him get counseling, because maybe there's something he's doing in his life that's abusing his body. But for me, I think if I had to say how long, I tell people it's a lifetime. You don't do yoga for a short time and quit. You don't get exercise and then quit. At least you shouldn't, let's say. But the frequency changes. Yeah. And if people just want to be out of pain and they want to leave the office, that's fantastic. We got you out of pain, and we'll see you next time it hurts. And that's probably half the patients that come to us, right?
Oh, absolutely. And when someone asks me that question, because everybody's heard this from somewhere, and it's usually goes, well, my friend said, once you start going to a chiropractor, you always have to go. Mm-hmm. And no, that's not, you don't have to do anything. But if you like the way you feel after you get adjusted, then yeah, that's going to be their thing. And yeah, you're always going to go. But yeah, for whatever phase someone is in is how often or how long they're going to be coming in for. So when someone really comes in, and we'll relate it back to what we said earlier with, what usually brings someone in. It's sometimes people just like getting adjusted, and we get new patients that are coming from other chiropractors, and they're coming in, and it's really a great visit when we get a new patient and someone says, oh, my old chiropractor is, I moved or something like that, and I don't have any problems, but I just like getting adjusted. I'm like, this is and I'm like, let's go. But
it's a very educated patient that says that. They really understand their body in chiropractic.
Yeah, I mean, it's fantastic. I love those new patients because they're there's nothing in pain. We're just keeping everything going. Everything's moving good. But the goal is I always say my goal is to get you feeling 100% back to where we were. And then after that, we want to maintain that. So whether that for you, maybe it looks like you're coming in, right now at this point, maybe it's twice a week for a couple of weeks, and then we'll taper down from there. But maybe it's when you're better, it's a month, maybe it's 2 months. I have some people like going 8 weeks, 12 weeks. I have some people who come in every 2 weeks after, and they're coming in with no issues. We're just preventing anything from getting nasty again, because unfortunately, one of the things that people need to be reminded of is most injuries that I feel like that we see is from overuse injuries, whether that's from posture or life or anything like that. The things that bring them into the office aren't leaving their life. They don't get to stop going to work and sitting at a desk. They're still going to continue to live their life. They're still creating that wear and tear, and those imbalances that we talk about where things will not move correctly forever. We need to make sure that everything actually keeps going the way that we want it to.
Yeah, it's a good point as to, the amount of treatment is also related to, can you stop what caused the problem? Like if you fell down the stairs, well, there's your trauma. That right. If it wasn't too significant of a deep injury, that's a series of visits and the person's good because they're not falling down the stairs, hopefully again. But if someone goes to work every day and pulls the same lever and jacks up the same car or is hunched in a stressed out position at their desk all day, that's a beating every time they do it. And I might be the best answer until they get another job, or until they can retire, or until they find a better way of doing that job, an ergonomic shift of some type, which we always give advice on as well. And but if someone's going to come in and say, okay, I'm a little messed up, I'm pretty stiff, I know I need chiropractic care, how long should I come? I'm always like, if you want to sort of sample chiropractic care in a fair way, come to me for 6 weeks, see me twice a week, and then we'll talk. And at the end of that 6 weeks, you can tell me, what did we accomplish? And certainly we're going to talk about that every visit, but we'll say, okay, you started with these problems. We did this many treatments. What are you feeling now? And then I tell them what I see. How straight is your spine now? How much motion do you have? And I think in 6 weeks, a person says, okay, I get it. This is what this is like. And a lot of times people say, well, thank you, I got a lot done. When should I see you next? I feel fantastic. I'm like, let's back it down to 3 weeks and then a month. And I like treating patients to maintain problems, to maintain the treatment on problems that are being reintroduced through the stress of that person's life, whether it be emotional, chemical, or physical, once a month, because it gets them before they get that person too bad, right?
Right. Absolutely.
So, yeah. So I think that covers that. That is so people come at all different lengths of time, but it really depends on how young and healthy are you, what's your diet like, what are your stresses, physical, chemical, and emotional, and what are we trying to accomplish? Are you trying to erase years of abuse? Are we trying to get rid of something that every day you're kind of putting a little bit back in? Or are we trying to get you to decrease your drugs or get off some of those pain meds? As you know, the opiate problem we have in this country is historically bad.
Oh, yeah.
So I think that covers it. Does diet affect the back? Now, one of the things I looked up on this, because I know a lot in this area, and I know you do as well, but I wanted to see, what's out there as far as who's been able to sum it up. Because I know bad food and good food and what does a lot of stuff, but from the research I did today, actually, sugar, alcohol, and gluten are the most proven substances to affect your joints negatively, as well as your back. And I can tell you that I don't eat gluten, and I know when I've put people on gluten-free diets, I've had a bunch of people say, well, my low back just stops hurting, and when I eat gluten again, my low back starts to hurt again. And I think that's interesting. And one of the analogies I use is a condition called psoriatic arthritis. And it's a condition that has a very inflammatory component to it, and it's related a lot to diet. Another one is gout. Now, a lot of people have a condition where they eat a purine, a certain protein. It doesn't break down properly because they don't have the metabolites to break it down or the enzymes to break it down. And they end up with a crystal in their joint, and it hurts. So there's a perfect example, a really obvious example, let's say, of you ate a food and it ends as joint pain. And if there's a big obvious one, believe me, there's a lot of little subtle ones that are real sneaky that you don't know are happening. And I think gluten is a sneakier one. I don't know what's so sneaky about alcohol, probably nothing. But sugar is another one that there's, you usually know when you're drunk, right? But it's certainly even smaller amounts of alcohol over time can do that. And so what do you think of that? What do you think of diet and joint back pain? What are you seeing?
Oh, yeah, big time. I mean, when you look at the back, your spine is joints. And so we can even break that down into knees, because a lot of people come in and like, I got this knee problem, and maybe we clean up their diet. And I know that I've played with my diet plenty of times, and whether it's a lot of dairy, maybe introducing some fish oils, things like that are more anti-inflammatory. You look at the inflammation that food can cause. So gluten and dairy are probably the most, and alcohol are probably some of the most inflammatory foods that we can put into our body. What do we know about inflammation? I mean, it's gonna hurt things. So it's gonna irritate your joints a little bit. So if we can decrease the amount of inflammation that we're putting into our body, 100% we're gonna have decreased pain, whether that's knee pain, back pain, anything like that. Trish, she says, what does she say? She says she says gluten is the devil's work and dairy is its younger brother. So
okay.
There it
I
is.
didn't get that out of her on the podcast. That's a good one.
So
that's funny.
When you look at those two things, and like I said, how inflammatory they can be for your joints, then you'll notice a big difference when you start to limit them. And then it doesn't have to be an all or nothing thing. Like if you can, let's say whey protein, like that's where I get my dairy. I don't eat much gluten anymore. Usually a lot of my carbohydrates will come from potatoes, sweet potatoes, rice, and brown rice pasta. So those are primarily gluten-free foods, but in dairy, I have Greek yogurt and whey protein. So I'm able to really limit some of the big factors that's causing inflammation in my body. And I've noticed a big difference lately, and honestly, a lot of it with my knees and wrists are two of the big places that I noticed decreased pain. But that's not to say that it wouldn't cause a decreased amount of pain in someone's spine or an increased amount, or they're increasing that inflammation.
Yeah, that's good. Let's go to another question. Is my pain muscle or joint? I get people that, want to know, is it just a muscle in my back? And, that's another great, I think it's a great question. I find that they work together so intimately that it's difficult to have one without the other. Now, I have pulled hamstrings in my life and thought, okay, that is certainly a tendon very related to a muscle, or part of the muscle itself in the hamstring that I've screwed it up. And I used to believe that was just that. And one of the ways I solved that was to making sure I was a little more hydrated when I was doing like interval sprints. But I also realized that what a hamstring's attached to. It's attached to a knee and a pelvis. So one of the things I realized is I'm pulling the hamstring on the same side that I have a torn meniscus, and it's got to be related to that knee. And so I started to rehabilitate the hamstring, the knee, and of course get adjusted so my pelvis was moving properly. And I think that in that situation, you realize it's both, right? One just talks louder than the other one sometimes. So I make sure of that. I mean, what do you say for that question?
Yes. I mean, we know when we pull a muscle, right? And like I said, if we pull a hamstring or a bicep or something like that, we feel something in the muscle belly. Okay, yeah, that is definitely a muscle. But why? A good way to look at trigger points or knots or anything like that people can get. And some people ask, well, why do I have this knot that's always here? Usually a knot or muscle spasm comes from joint dysfunction. Something's not moving correctly somewhere around that joint, and then we get some sort of muscle pain. So yeah, 100%. It can be both, and it's always going to be case dependent per person. But usually, when one's not working right, the other one's not working right, is from what I have found.
Yeah, exactly. Right. And in a back, it's a little more confusing because things are so tightly close together. And those back muscles, I always tell people there's like veneer, right? One layer of muscle over another layer, like 6 layers of muscle that are subdivided into other layers. And it gets a little more confusing. But as you do, we do soft tissue work on our chiropractic adjustments along with our chiropractic adjustments. And so we're addressing the muscle. And if we're addressing the person's water intake and their protein intake, they're going to be building that muscle back. But almost every time I've seen somebody with back spasms, as some people will call them, it certainly could be a hydration or a mineral issue, but most of the time, those are improperly functioning joints, and the muscles are doing their best to try to deal with a rusty hinge of a joint or a misaligned vertebra, right? So I think that's the best way of answering that, is that it's usually a combination of the two. And I don't want to just be, a classic typical chiropractor and say, well, it's always the joints, but it does seem to be the joints more than the muscles. And of course, they both need to be addressed. If there's one thing I have tremendous respect for, it's massage therapy. I get massage therapy and recommend it constantly. We have massage therapists all over our office. And the ones we have are fantastic. And they can change your life. I recently had a patient go for his first massage. He's 51 years old and has, a myriad of health problems, wonderful guy. And he of course loved it. And I told him, I said, this is going to be your thing now. Get ready. You're going to love it. Right. And he did, of course. And so, so we want to address the muscle as well. Here's one I think you'll be able to answer really well. When should I stretch and when should I strengthen my back?
So together,
right.
Are you talking about like around an injury or?
Yeah. Someone hurts their back and they want to know, should I be stretching this? Should I be strengthening it? When do I start the strengthening? That kind of stuff.
So that's a great question, and that's why when someone comes in, my philosophy for this is usually people get injured because they're weak, and one direction or another. And somehow that's how that tissue got injured. That disc got herniated, and that something is weak, something is not as strong as it should have been. The volume of work that they were doing, whether that's picking up pumpkins for Halloween or raking their backyard, the volume of work that they did exceeded this person's capacity of work. So something wasn't strong enough to keep up. That's generally where we're looking with that. When to strengthen is when you're able to. As soon as you're able to. So I have patients who come in who blow up their low back, and maybe it was because summer's coming and they want to lose weight for summer, so they're going to do beach body workouts every single day until their back explodes, and then that's what usually brings them in. But at that point, they can't move. They can't bend over. They can't even think about doing any kind of exercise. So we stretch it out. We stretch it out in the office. We give them home stretches. Then, soon as they're able to, it might be a week, it might be 2 weeks, we start incorporating some strengthening exercises for the core and the low back. So as soon as that person is able to strengthen their core, and that's usually what it is, for a low back at least, then we're strengthening. So whether that's a dead bug or a plank or bird dog movements, those are my big core exercises for everybody. I usually will send people videos to their email, and then basically like, this is the exercise that you need to do as soon as we're able to do it. And then I'll give them the green light. I'll say, okay, this is the exercise we can do. In the past, one of the things that I've done years ago was, okay, we're going to start doing this exercise now. And then they're not able to do it because it hurts so bad. So soon as someone is pain-free enough to complete this exercise, to the point we're not doing any further damage, is when we need to start strengthening. And that needs to become part of what they do as their home care.
I think you're absolutely right. So the basic premise there is, as soon as they can, and using pain as a guide, you want to start that strengthening exercise to deal with the load that they may be doing, whether it's work or, like you say, doing the beach body workouts, which are always fun. I used to watch the advertisement for the beach body workouts while I was working out, just to look at the moves they were doing as a chiropractor and go, wow, yeah, like 2% of the population is going to get away with that without ending up at the chiropractor or, swallowing some over-the-counter pain meds or something. But sometimes people get results in those workouts, and they're not the end of the world, but obviously they're a little wild.
My analogy with that is, it actually I don't make this stuff up. This is what people walk in with. So yeah. And this isn't bashing beach body or anything like that, but no. that amount of work to recovery that we talked about earlier, when it comes to working out or athletes or anything like that, doing those workouts more is not always better. People think that, okay, I need to get ready. I'm going to do this 7 days a week, but I just went from doing a whole lot of nothing over winter to working out 7 days a week in my living room is usually what lands them in the office. But taking those workouts, like I said, nothing against those workouts, but maybe spacing them out, every, maybe 3 days a week to start off, not 7, would be I'm
glad you clarified that. I never want to mock or put down anything that gets somebody to move. And it's so admirable when someone changes their life, and if it takes a beach body infomercial to get you off going, and that's fantastic. So just be careful. I like people that go to people like us, and especially in your world, and get some advice on how to get their body moving. But those programs can also do a good job. Next question is, how do you treat elderly people? And I can start by telling you that there's always more complicated conditions when you're working with someone that's a little bit older. You're dealing with a lifetime of potential diseases and some hidden conditions that you will discover as you start to do an exam on them. And of course, the word gentle is the first word you say, because you want to start slow, and you want to look at bone integrity. Osteoporosis is a major condition in our country. And assess the amount of load, and then pick a treatment style. At least for me, pick a treatment style, and for you as well, that works gently but effectively on that type of patient. Probably the opposite of a 25-year-old CrossFit athlete would be a 75-year-old patient, right? Because the body has lost a lot of its elasticity, it's lost a lot of its strength, and the bones are thinning, and in most people of that age. And so the technique it may take longer to get that person better. Most people are very happy when I tell them we're going to take this slow. And they're like, oh, yeah. I mean, you say that to a CrossFit athlete, and they're usually like, no, we're not taking this slow. I want results now. I want to get better in 5 minutes.
Yeah.
Right. So when you tell an older person that we're going to take this slow, they're usually relieved because they see you as a chiropractor who's going to twist them and pound on them. And they want to be assured that that's all going to go well. And I 100% respect that. So that's what we do. We start slowly, and we keep in mind all the potential conditions they may have buried beneath in nooks and crannies of their body. And, ask a lot of questions, get them talking, and of course, address all the stuff that we address with anybody else, their hydration, their protein intake, and look at, and no two patients in general are the same, but it's certainly the case as people get older, because people aren't always the same age that they're chronologically. Their cellular age versus their chronological age can be very different. Either way, you can have someone who's a young 70 and kind of have an old 70 year old. And that would come along when I say an old or young. I mean, how much elasticity, muscle mass, dietary, genetics is a factor, but a lot of times it's lifestyle. What has this person been doing for 70 years? Are they building a stronger body, or are they letting a more decrepit body take over? Have they surrendered to the sofa, or are they out there, with their backpack on, with cleats on, in the wintertime, climbing the side of a mountain? And both those patients are wonderful to work with, but you got to meet them where they're at, right?
Yeah, you can't pick what they're doing, right? So you get what you're given with that. But yeah, I agree with that. You definitely have to take more of a gentle and slower approach to whether that's manual treatment or the activator, or the adjusting tools that we have at the office. And combine them all together to see what works with that person the best. But one of the biggest things is the osteoporosis, and that's like every elderly person's number one concern. Like, I have osteoporosis, I can't go to a chiropractor. Well, let's see what we can do, and we're not going to do any popping or cracking. We're not gonna we'll take everything as slow as we can with it, so it's safe and effective for you. But after that, let's work on the osteoporosis, and that's one of my favorite things to do with people, is to get, all right, let's get this problem fixed, but then let's work on the next thing that we want to, that osteoporosis is obviously a big concern of yours. So, that's where we have the vibration deck at the office that people can go on to improve their bone density. Recently, I've had we'll say she's 70, 70-year-old patient, brand new to chiropractic, terrified. She came in the first time. She said, I have osteoporosis. She was standing in the corner when I walked in the room, was like, I don't know what you're going to do, but I have osteoporosis and I don't want you to break me. And don't worry, she's like my best friend now. So I actually got her working out here at the CrossFit gym.
Oh, wow.
Her back pain is gone. She's 100% better. But we're working on strengthening her body. And when it comes to osteoporosis, or just people in general, we don't have, maybe we've gotten ourselves into that because we're not actually loading our bodies enough. So she comes to the gym and carries weights. That's I hooked her up with a trainer here, and she comes to the gym and carries things now. She's doing all sorts of core strengthening, and everything from the farmer's carry to the suitcase carry, the goblet carries with kettlebells, just to load her body so that we're adding that stress to help lay down more bone. And that's where adjusting people comes in handy too. I mean, I used for this patient in particular, I used the adjusting tool on her, which for anybody who doesn't know is like a jackhammer for the spine. And
that sounds terrible.
Terrible. Your mom.
No, I'm kidding.
She loves it though. that's delivering that impulse to the spine and the joints that we're working on to hey, let's lay down some more bone. Let's make this a little bit more resistant to gravity here. So
yeah, I think
all sorts of stuff.
Exactly, like you say, we call that thing Dr. Jack for Dr. Jackhammer, because it moves, it moves repetitiously and it impulses. But the funny thing about it is it's gentle, right? I mean, that is something that it's almost vibrating, impulsing. It splits the difference between what's a vibration in frequency and what's an impulse. And I love that tool. You've used it on me. I've used it on you. And it's a nice adjunct to put in. And I have, I don't know, probably 10% of my patients I use that on, either in part or in total. I think you're about the same way. Sometimes we're wrestling over that tool during the day.
Yep. Yeah, we got I got 20-year-olds that love it. I have 70-year-olds that love it, and it's great for everyone. It's not just for the older people, and we can definitely accomplish a lot with the younger population too.
Yeah, it's so specific. The contact points are so nice and small. You can get exactly where you want to get in a person's back, whether you're doing a soft tissue, sort of a treatment with that tool, or you're doing it to create a little bit of rocking and stimulus to the joint. Because anyone that knows me knows that one of my definitions of disease is stagnation, and the cure is flow. And I think that those tools and that kind of technique is great for creating that kind of stimulation and that kind of flow. So that's good tips. Another question came up, and I see this because people get back pain, wake up in the morning all stiff, is, what's the best way to sleep? My recommendation for sleep is always to lay side-lying with a body pillow. So you got one arm and one leg on the body pillow, and try to keep the knees about the same amount of bent, because we don't want them up by our chest. And if they're straight, we tend to just roll over onto our belly and end up a belly sleeper. So it's almost a fetal position, but not that curled up. It's like an open fetal position is what I recommend. And to make sure the pillow is thick enough to accommodate the space between your ear and your shoulder. This space in everybody is a little different, depending on the width of your shoulders and the width of your head. And also how soft the mattress is. If you sink into the mattress, in a sense, the pillow gets, in a sense, fatter, and all of a sudden you're jacked up like that, which is never good. I tell people to lay left side down because the heart doesn't have to beat uphill that way. And pretty much that's it, and I also tell people it's okay to move at night. It's okay to move back and forth and stretch the body out a little. There's nothing wrong with multiple positions at night, but making that your primary. What do you think of that?
I agree. A body pillow will change so many patients' lives, and it's one of the simplest you can do. And that's, I just had this talk with a patient recently too, and she's like, when I wake up, I feel great when I go to bed. I wake up and I feel like a truck ran me over. How are you sleeping? And she's like, I don't know. And I recommended the body pillow. And for shoulders too, a lot of times people I hug that pillow and get your leg on it, because when people hug that pillow, it takes a little bit of pressure off their shoulders, so they're not like getting all internally rotated and jamming into their shoulder, and so their arms go numb. So the body pillow definitely changes people's lives. The other thing too with the pillow for their head is just picture sleeping neutral. I said my rules for sleeping are sleep as neutral as possible. You wouldn't sit at your desk all day with your ear touching your shoulder. That wouldn't feel good if we did that for 10 minutes. So how's that going to feel for doing it for 6 hours while you're laying in bed? So find the pillow that's going to equal that space between your shoulder and your ear without you squishing it down, so that if you're a side sleeper, you can keep your head neutral all night. That with the body pillow are like the two biggest things. And no, I don't have a pillow that I recommend. What pillow should I get? Mm-hmm. And there's so
it's a trap. It's the worst.
Got the pillow. Everybody hates the My Pillow guy. But I don't have one that I love. Something that's on the firmer side is usually what I recommend, so that your head doesn't sink down into it. But whatever someone can do to keep their head as neutral as possible, so that they're not leaning one side or the other. And for God's sake, stay off your stomach.
Yeah, exactly. Good point. Good point. That's like the worst thing. And I always tell people, if you are a stomach sleeper and you can't stand it, get a body pillow, because it'll give you a similar stimulus, but not have you on your stomach. And I think that's crucial. And I can remember when I first started as a chiropractor, I thought, okay, I am going to research pillows. I'm going to find the ultimate pillow, and that's what I'm going to carry at the office. I'm going to help out my patients with the greatest pillow man has ever devised. I'm going to use all my knowledge in biomechanics and spinal conditioning. And I ordered a pillow, and just about everybody hated it. Then I said, well, that one's hated by everybody. Okay, I like it, but I am not normal. So I got another pillow, and about 10% of the people liked that, and people wanted to bring it back. And I'm like, oh God. So pretty much I went through about 4 pillows before I learned the lesson that it is a very personal choice. I carry 2 pillows at the office, and I tell you, and I don't sell many of them because I can't even talk them up because I've had, like, I've almost had like some kind of damaged psyche from trying to find the right pillow for people. So I'm like, hey, these are 2 pillows. That's the one I sleep on. This one's similar, but you can change it a little. So it's kind of cool. That one you can't change, but we measure that one for you. And feel free to take either one of those. But, I have no guarantees, and good luck out there. But I highly recommend, like you do, the body pillow. That's a no-brainer for me. And one cheap solution, I tell people, if you get some kind of sticker shock when you're looking at the price of a body pillow, I don't know why you would, but let's say you do, you can buy a body pillow case and stuff it with old pillows. Yeah. And you all of a sudden have a body pillow. So, I mean, get the one with the zipper on the end to keep all your pillows inside that case. You got it.
Hug it, and then put something between your legs if you want. I mean, that's how I hug a pillow at night when I sleep. I sleep on my side, hug the pillow.
So do I.
If you don't have a body pillow, just steal your significant others and hug it.
Yeah. It's a war. It's a war in that bed.
For pillows.
We got one last question, and before I ask you that and get into that, I just want everyone to, if you like these videos, subscribe to my channel and give it a thumbs up, and please leave comments. We try to leave some things in the links for books and different materials that sort of support what we went over today. So please do that. The last question is, what about a takeaway? Like you and I were talking to come up with, people want to know, just give me a quick something to change my life kind of thing. And for me, when I get asked that question, what's a thing, is I'm always like, the least exciting and simplest thing is to master the fundamentals, realize the value of discipline, and follow through. If I've learned anything in my life, it's about consistency. Diet is such a perfect example of that. When you go on a nutritional program, I think what you realize is that, you can't have a salad and then get on a scale and expect something to change. You can't lift weights for a couple of days and start to join the Olympics. It's about every day putting out some amount of effort. And if you want massive results, you put out a lot of effort. If you just want to cruise a little and have smaller results, you put out less effort. Either one works. Time will win, even the slow approach. So for me, it's, master the fundamentals, which is, water intake, nutrient intake, movement, breathing properly. And then, as when we had Brittany Stamer on, one of the things I learned during that podcast I thought was fantastic is surround yourself with a community of people that support your goals. I know you are surrounded by CrossFit athletes and athletes as a whole, and I'm surrounded as well by people like that, cyclists and people that weight train. You and I, we joke that if it made us stronger, we might even drink dumpster juice. Yeah. I'm definitely in that camp. So what would you tell a person in a similar scenario or similar question to that? What's a good takeaway?
I love like simple things, and mastering the fundamentals is huge. Water, diet, all that stuff. One of the biggest things that I like, aside from the body pillow changing people's lives, something so simple, something that will change like anyone with any sort of low back pain, because that's where my head automatically went when I heard this question, is something, the simplest thing that I can give to somebody that that changes them. And they're like, oh my gosh, like, why wasn't I doing this before? And it's learning how to bend over.
Yeah.
And because most of the time if someone comes in is they don't know how to bend over to pick something up. So I teach them how to hinge down properly so that they're not bending their low back and flexing it to pick up the laundry basket, because you can get away with that for a lot of years, but then once that you've done it one too many times, and we're gonna end up with some back pain. But it's such a hard habit to break. So the simplest thing that I give people for homework is learning how to bend. And I teach them how to bend, keeping their back straight, feeling the stretch in their hamstrings rather than their low back, and pretend like everything's heavy. So when you pick something up, pretend like your clothes basket weighs 100 pounds. So you're going to bend over a little bit differently to pick that up if it was 100 pounds, rather it be 5 pounds or anything like that. So my biggest take home for people usually is for low back pain or anything like that is learning how to bend over properly. And I know it sounds silly, but it's something that'll definitely change people's perspective on everything, habits that they're doing every day, whether it's tying your shoe, picking up a pencil, wiping your dog's paws off. Like, I have 3 dogs. They are complete muddy jerks this time of year. So I have 12 paws to wipe down every time they go outside. Yeah. So I'm constantly bending over. So I know a lot of other people are too. And that's one of the things that I tell people to do. And it changes everything. We learn how to hinge properly. It takes a ton of pressure off the low back. And people are like, why wasn't I doing this before? And then no one laid it out like that. So
I think you're right on. You're right on about that. I think it's something that could destroy somebody's livelihood. Bending wrong repetitiously, a disc herniation, and wow, your life's a whole different life to try to repair that and deal with that. It's a semi-permanent deformation in your back from doing something wrong that a lot of people would never consider, that big of a deal. But I know I'm a chiropractor, so I'm going to agree with you on that one 100%. But our audience is probably going, okay. But anyone that has lifted to pick up a pen and then had a shooting pain through their back like an arrow realizes, oh yeah, I know what that's about.
I fell into that trap, changing headrest paper.
Oh, really? Okay.
A couple years. Yep. Bent over one, and it's you learn by doing the same thing over and over again. So bent over one day to change the headrest paper like 5 years ago, and I was like, wow, my back kind of hurts, and
that's funny.
I think like a jerk. So one of my stories I tell.
We all get caught up sometimes not practicing what we preach a little bit, but as long as we clean it up pretty quickly, we're going to be all right.
Everyone.
All right, Doc, that was great. I appreciate you coming on the show again and going through some basic questions. Anyone has other ones, please, put them in the comments on this video. We're happy to have everyone and just, teach people and grow and get the information out there, because, the mainstream media is a disaster area, and you got to get your facts, I think, from people that have expertise and no financial bias in what they're saying. So thanks for watching, guys, and we'll see you next time.
Right. Have a good one.